Hi, everybody. This is my educational piece on non-pharmacological stress management for optimal health. During this presentation, we're going to be looking at the correlation between stress and illness, the relationship between stress and addiction. We will be identifying early signs and symptoms of stress, and we will go through a demonstration together. Nurses, we're at especially high risk for stress and burnout. We have demanding schedules, we work when we're short-staffed, we take care of sick and dying patients. We have also been dealing with the current COVID pandemic for the past year as well. So my teaching episode will go over all of these things, and the goal of this is to increase your knowledge and your comfort level in this area so that you'll be able to utilize these methods to manage your stress and the stress in your patients as well. So let's begin. So first, let's take a look at the pre-survey results from my pre-teaching survey. These were actually pretty surprising to me. As you can see, I just highlighted the strongly agreed findings below, but you can see the full results using the link. For time purposes, we'll just be looking at the ones I've listed below. So 80% of you strongly agreed that you recognize a connection between stress and illness. 20% of you recognize the connection between stress and addiction. 40% recognize the connection between effective stress management and optimal health. 100% of you agree that nurses are at an especially high rate of burnout due to chronic stress. 60% of you feel that non-pharmacological holistic methods can be effective stress management tools. Only 10% of you use regular non-pharmacological stress management methods for yourself. And astonishing, 50% of you disagreed, you don't use them. 10% use regular non-pharmacological stress management methods for patients. 10% of you feel you can identify early signs and symptoms of stress in yourselves, and 20% of you can identify early signs of stress in your patients. And lastly, 20% of you are comfortable using non-pharmacological or holistic stress managements with your patients. So one of the things that really struck out to me was that 20% of respondents reporting being able to identify early signs and symptoms of stress in their patients, yet only 10% can identify the same within themselves. So we need to change this. This data here supports exactly what I'm speaking about, how we are at increased risk for chronic stress and burnout, and we really need to take care of ourselves, guys. We are not able to care for anybody else effectively until we are caring for ourselves first. So let's first talk about the fight or flight response. We've all heard of it. Stress is your body's way of responding to any kind of demand or threat. So when you sense danger, whether it's real or just imagined, your body, the defense mechanisms kick into high gear. Your heart might start racing. This is your stress response. This can be helpful in certain situations, but not when it starts causing damage to your health, your mood, your productivity levels, your relationships, and your quality of life. So if you frequently find yourself feeling frazzled, stressed, overwhelmed, it is time to take action to bring your nervous system back into balance. You have to protect yourself and improve how you think and feel by learning how to recognize these signs and symptoms of stress and taking steps to reduce its harmful effects on your health. So here are just some of the ways that stress does affect your health. It disrupts your hormone levels, okay? It increases your cortisol levels. This increases your inflammation in your body. This in turn decreases your immunity levels. Leaves you at risk for depression, anxiety, pain, sleep problems, autoimmune diseases, GI upset, digestive problems, skin conditions, acne, eczema, cold sores, heart disease, weight problems or changes. Maybe you're losing a lot of weight, not trying to. Maybe you're putting on weight like me during COVID. I've been, can't use that as an excuse anymore. Also reproductive issues or, thinking, concentration, memory problems, all of these things are shown to directly negatively impact your health. Going on, talking a little bit about the correlation between stress and addiction, like disordered eating, nicotine, alcohol, and drugs. So some people, rely on their own devices to cope or self-medicate. Some of these methods are unhealthy. They include these listed that I just mentioned, and it's really important to be able to identify and recognize stressors early on in ourselves as well as our patients so that we can implement effective supports and strategies as early as possible. And just to list some of the stressors that we can identify: death, grief, illness. Maybe you're struggling with finances, grades, trying to balance everything: work, life, school, kids, families, any major life events or changes. Maybe you've got caregiver strain, relationship issues, lack of supports. All of these things contribute to stress and addiction and impaired health. Moving on, identification of early signs and symptoms continued. I think this is just also reiterating what we just talked about, just, memory or cognitive issues, sleep disruption. That could mean maybe you're not sleeping well at all, you're waking up a lot more at night or frequently, or maybe you're sleeping an awful lot more than you normally do. Worrying, feeling anxious, depressed. Maybe you'll notice in people, your patients, they're just not caring about their hygiene, looking more disheveled. People sometimes they withdraw and they isolate. They don't feel up to dealing with other people and being in social circles. Complaining of maybe vague aches and pains or things that are really not founded based on any kind of medical testing. Again, stomach issues, nervous habits like fidgeting, nail biting, picking skin, and again, substance abuse, using alcohol, drugs, nicotine, etc., to try to relax and feel better. What works for you? So now that we have a better understanding of the importance of healthy stress management methods, I challenge you to start with just choosing one method that you will commit to using daily in your personal and try it in your professional life as well. There are so many great options that you are bound to find something that works for you. I included here some things that work for me. So in the top left corner, you see some books. These are some things that I'm interested in. I like to read about nutritional healing. I'm very spiritual. I am a Reiki practitioner. I am certified in the use of healing crystals. I use aromatherapy. So that's what that picture is. Below that is a picture of me finishing my second half marathon. In the middle is a picture that I took in one of my favorite places to be in Maine on vacation. Vacationing helps me relieve my stress, although sometimes I need a vacation from the vacation, which I'm sure you can relate to. And I love photography. I love being outside. I love hiking. So just finding what works for you. In the top right is a picture of a setup in my home during COVID. getting creative and doing a distance Reiki session for somebody. And below it is a picture from my Reiki studio. So I just want to end with this 2-minute guided breathing meditation video. And I'd like you to try to relax and get through it with me and see how you feel.
This is Susan with blendedinsight.com, and this is a meditative breathing technique to help you activate your parasympathetic nervous system and calm your physiology and stress response. This technique is really simple, and you can do it as often as you think of. And how we're going to do this is we're going to breathe in through your nose to the count of 4 and out through your mouth to the count of 8. And when you exhale, imagine yourself gently blowing like you're blowing out a candle or blowing a bubble. This will help you slow down the exhale. So all you have to do is follow along. And with that said, let's get started. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6, 7, 8. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6, 7, 8. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6, 7, 8. And now just follow my commands of inhale and exhale without the counting. So inhale and exhale. Inhale. Exhale. Inhale and exhale. And relax.
I hope you enjoyed that little demonstration. I know I did. And here are my references. I hope you were able to take away from this and learn something. And I'm very interested in seeing what your post survey results show. Thanks so much. Bye-bye.